in lung cancer, a lot of times, most people don't have symptoms. And by the time they come to see the doctor, it's usually the cancer is really in the advanced stages.
Too late, basically.
Yeah. So, and then...
So how? What if I have lung cancer now and I don't know? Hi, Tezo.
Hey, Azura.
And welcome back to another episode of Clarity's Hush Podcast. You know, here at the Hush Podcast, I really love educational episodes, and today is just one of them. I would like to warmly welcome our special guest, Dr. Tanujaa.
Hi guys, I'm Dr. Tanujaa Rajasekharan. I'm a medical oncologist at Parkway Cancer Centre, and I'm really glad to be here with the two of you.
I'm really glad you're here because today's topic revolves around lung cancer. Now, doctor, before you tell us more, Zura, what do you know about lung cancer?
Not very much. I think when we think about cancer, especially in women, I think we hear a lot about, ovarian cancer, breast cancer, and that's the one that we think we're most at risk to, right? So not very much about lung cancer.
Okay, when I think about lung cancer, I think maybe smokers. Smokers get lung cancer, and like in the X-ray or whatever it is, there's grey spots in the lungs, and that means you have lung cancer.
What drama you watch?
Am I right or am I wrong, doctor?
Okay, you're not completely wrong. Maybe I can start with telling you what exactly lung cancer is. So when the cancer begins in the lungs, then we call it lung cancer. And cancer essentially is the uncontrolled growth of abnormal cells. So these cells grow and they continue to grow. And as they grow, they can affect, let's say if you start off with the cancer being in the lungs, as these abnormal cells grow, they affect the function of the lungs. Right? And potentially what can then happen is that these cells can then spread outside of the lungs to other parts of the body. And when that happens, we say this is metastatic cancer. So these cells can start from the lungs and spread to the bone, to the brain, to the liver, or any part of the body. Right? And lung cancer is actually the third most common cancer in both males and females in Singapore. However, is the number one cause of cancer death in Singapore.
Wait, now I'm curious. So for males, what are the top two types of cancer?
So for males, the number one most common cancer is prostate cancer.
Okay.
The second is colon cancer. And then the third is lung cancer.
What about for females?
So for females, as Azura rightly mentioned, so breast comes out as number one.
Okay.
And the second is colorectal cancers. And then the third is lung cancers.
Oh, so colon cancer and lung cancer are like second and third for both male and female.
Yes, absolutely.
Wow.
So correct me if I'm wrong, but we've all got cancerous cells in our bodies, and we are diagnosed with cancer when it's activated or when it gets active. Is that correct or is that wrong?
Okay, so not that we all have cancer cells in our body. So sometimes what can happen is that your normal cells can undergo mutations, right? Or abnormalities for various reasons. And your body actually has an immune system and is meant to go and remove those abnormal cells. But when that doesn't happen, these abnormal cells start to grow and multiply and then potentially cause problems. And that's when the patients are diagnosed with cancer.
Okay, so what causes the mutations of our cells? Is it something we eat? Too much UV rays from being under the sun?
Is it something we can avoid?
Yeah.
The short answer to this is, can we prevent cancer? The short answer is no. But what we can do is reduce our risk factors for cancer. So different cancers have different risk factors. So let's say, for example, we are talking about lung cancer, and the most common risk factor for lung cancer is smoking. Right? So if you want to reduce your risk for lung cancer, definitely if you're a smoker, please stop smoking. And the other common risk factors for lung cancer are like exposure to secondhand smoke, or if you have a strong family history of lung cancer, or exposure to other carcinogens such as asbestos, radon.
Okay, what are those? Paint?
No, so those are chemicals essentially, right?
Okay.
Yeah. But the thing is, these are risk factors, but they are not causes, meaning that there are people who smoke who don't get cancer, and there are people who don't smoke who get cancer. So these are risk factors. So what we can do is, of course, control our risk factors, but we cannot say that just because I do this, I'm not going to get cancer.
Yeah.
Okay, so how can I sort of like test for lung cancer? How do I know if I have lung cancer? Do symptoms start to show up? Or is it my yearly review?
So I'll start off with the symptoms first. Okay, so people with lung cancer can present in a variety of ways. So for example, some people can have symptoms related to the lungs. So some people can have a persistent cough that doesn't go away. I could have difficulty breathing. I could have wheezing. I could have chest pain. Or they may have, because as I said, cancer can spread to other parts of the body, right? So if let's say they may have symptoms related to spread to other parts of the body. So for example, if the cancer has spread to the bone, then they may have bone pain. Or if the cancer has spread to the brain, then you may have headaches. But the important thing to note is that unfortunately with lung cancer in particular, a lot of people don't have symptoms until the cancer is very advanced.
Oh no.
Wait, this is different from other types of cancer like breast cancer, colon cancer. You get symptoms quite early on.
Yes, potentially. So, but in lung cancer, a lot of times, most people don't have symptoms. And by the time they come to see the doctor, it's usually the cancer is really in the advanced stages.
Too late, basically.
Yeah. So, and then...
So how? What if I have lung cancer now and I don't know?
Then you asked me about screening. Is there anything that I can do with regards to screening? So screening is a whole different other ball game. So when you talk about national screening programs, so I'm sure you've heard of the mammogram screening, pap smear, right? So the screenings that are advised for ladies, let's say if I'm above the age of 40, I should go for yearly mammograms. If I'm sexually active, I should have a pap smear once every 3 years. And for colon cancer, the screening is that if I'm above the age of 50, I must make sure I get at least a colonoscopy done. But unfortunately for lung cancer, the only advocated screening thus far that's shown benefit is actually a yearly low-dose CT scan, but only in adults who have a very strong smoking history. So adults between the age of 50 to 80 who have a 20-pack year smoking history, which actually means basically I've been smoking 1 pack a day for 20 years. So if you fit that criteria, then it's recommended that you go for a low-dose CT scan. But if you don't fit that criteria, then CT scan is not recommended for you at this point of time.
Why?
Because
radiation.
Okay, so screening, there are a lot of caveats to screening that we need to consider. Before something can be said to be a population-based screening, it needs to meet certain criteria. It needs to be cost-effective. And also it needs to be something like, for example, if I do low-dose CT scan, it comes with its own risks. Firstly, you're exposed to radiation. And also what happens is that potentially I can pick up, there are false positives, meaning that if I do a scan, I may pick up nodules, which are actually not cancer.
Okay.
Right? And because it's not cancer, then you cause anxiety to the patient. And then the patient has to go for additional tests, right? Like biopsies, which comes with risks as well. So at the population level, so far it is not found to be effective. And this is not just in Singapore, it's across the world. So for lung cancer screening is only for heavy smokers, but a lot of research is going into this because in the Asian population, Singapore included, a lot of our lung cancer patients are non-smokers. Yeah.
Casey's just in panic this episode. So, doctor, actually my question to a lot of doctors is that, for us, right, sometimes we have little symptoms that, we tend to ignore. If we do something about everything that shows up, we would be on medication 24/7, would be at a doctor's like
it would
every
be very
other day.
anxious.
So we can't tell when we need to do something about it and when it's just, a passing headache, for example. Because some people, they sit on it for so long that it becomes bad, right? I think we hear a lot like, oh, you should have come sooner, or you should have gone to the doctor earlier. But sometimes these symptoms are so normal that you just, write off like,
You're absolutely right. So I think the key point to this is persistence. So let's say if you have a passing headache, the key word is passing, right? So the headache goes away. But if you're having a headache every day and it's getting worse and it's not getting better in like, let's say after you take your painkillers or with rest, then these are like warning signs, right? So, okay, maybe you should go and see a doctor. It may not obviously mean that you have cancer, but I think good to get it evaluated. So similarly for lung cancer, right? So a lot of smokers, for example, have a smoker's cough, right? And that is in the background all the time, right? And then by the time where they have something that is really persistent, most of the time the patients would tell me, but I've had this for many years, right? So why should I bother about it now, right? So I think, for example, if you have something that the key thing is if it's persistent, right, and doesn't go away despite you, resting, taking medications, I think just go and see a doctor. Yeah, in a sense, there's nothing to lose.
Correct. But what I've gathered so far is that might still be too late. By the time the symptoms have been around for a period of time, I go and consult a doctor, it might already be too late, right? Because the symptoms don't show for lung cancer in the early stages.
You are right. So sometimes by the time symptoms come, potentially it can be quite late, right? But the other thing to be concerned about, especially for lung cancer, is let's say if you have a very strong family history. So I just saw a patient and she was seeing me for something completely different. As I was talking to her, she told me I've got a family history where 3 of my brothers have lung cancer.
Oh.
Yeah, so I said, oh, okay, then I think maybe we should talk about, screening for you. I mean, this is not part of the guidelines, but obviously you are very high risk if you tell me that you have 3 brothers in your own family.
Yeah.
These are your blood relations. Blood relations. Then, then for you, maybe we should talk about screening.
Right.
Dana, did she have it?
She's got other problems to sort out first. So,
Oh no!
yeah, but eventually I think we'll deal with one thing at a time.
Okay, all the best to her.
Wow. So most of your patients, when they come and see you for lung cancer, because, like Hazy mentioned as well, the symptoms don't show. And you said, a lot of times when they come, it's a little bit too late. So most of these patients, when they come, at what stage are they?
Okay, so I'm a medical oncologist. And okay, what exactly that means is that, maybe I'll just explain this a little bit better, is that, so cancer care is very complex nowadays. It's not just one doctor dealing with one patient. So it's usually a multidisciplinary team. So for example, the patient starts off with an abnormal X-ray and then he'll probably be referred by the GP to the lung physician, the respiratory physician, who may then say, okay, I think you need a biopsy. So that is done by potentially the respiratory doctors or the surgeons. And then there's a pathologist who reads the reports and says, okay, is this cancer or not? And then after the cancer diagnosis is made, then the patient is sent to me. I'm a medical oncologist who delivers systemic therapy. So systemic therapy is basically anything that goes into the bloodstream to kill cancer cells. It can be the form of chemotherapy, immunotherapy, targeted therapy. And my other colleague is a radiation oncologist who administers radiation. So usually by the time the patients see me, the medical oncologist, most of the time they have a diagnosis of cancer already. Someone would have made the diagnosis and sent them to me. But how they may be picked up is, for example, they may have gone for a CT scan for something completely different, right? And then incidentally, a lung nodule may have been picked up. Or for example, as part of, employment screening, they get a chest X-ray done and some abnormality is picked up.
Okay.
And then so eventually they may come to us. So in those cases, potentially patients can be in early stages.
Okay.
Or even some patients with symptoms. It's not that if you have symptoms, definitely it's going to be the advanced stage. It doesn't always be like that. Sometimes some patients with symptoms can also be found in the early stages as well.
Wow. So if it's a stage 3 or 4, it's a very high chance that that patient cannot be saved. Am I right?
No, that's not true.
Okay.
So generally we say stage 1 and stage 2 lung cancer are generally considered early stage lung cancer. Stage 3 is considered locally advanced lung cancer, and stage 4 is generally metastatic lung cancer. In the past, maybe if you were talking about 20 years ago, whenever someone said that, if you're diagnosed with stage 4 lung cancer, then we'll say, oh no,
You're done for.
Prognosis maybe at that time was 6 months, but it's no longer like that anymore.
Okay.
Right?
What is it like now?
Yeah. So depending on the type of lung cancer that the patient has, some people can live for many, many years, right? We are talking more than 5 years. And some people, lung cancer is in some ways, in some people have become like a chronic disease. So they take medications in the background, but you still can go about your life as per normal. A bit like diabetes, high blood pressure. You can't cure these diseases, but you can control them with medications.
Well, I cannot imagine the number of people you must have seen crying because one of the family members are diagnosed with cancer. Oh my gosh. How do you deal with that on a daily basis?
So it is tough, but in all this adversity, you also see the patients and the family members displaying lots of strength, lots of courage. And to me, that's the thing that inspires me every day. Yeah. Some of them can have like a really bad day and, they've just been told they've got like stage 4 lung cancer, but they're so kind and generous and they'll still ask you, how are you doing, doctor? So I think it's the human spirit is very, very inspiring.
Yeah, when they themselves are not in the good place, they extend their generosity and kindness and ask, how are you doing instead?
Yeah.
Must be very taxing and draining. Yeah.
Yeah, but very fulfilling as well.
That's very nice.
When a patient recovers from a long journey of battling cancer, right? I believe that brings you a lot of fulfillment.
Absolutely. Even if they don't recover, or even if you think of this as a chronic disease, just walking with the patients, being with them on this journey, I think that's very fulfilling as well.
Wow. So here I want to share some stories that we saw online that totally freaked me out, okay? So this is a lawyer based in North Carolina, and she said that the day after Thanksgiving 2 years ago, she woke up feeling pressure in her chest. Then she started coughing. So this lawyer went to the doctor and got a COVID test, but it was negative. So the doctors thought it may have been pneumonia, so they put her on antibiotics. And Emily was 39 years old, relatively young, I would say. Never smoked a single day in her life. So no one suspected lung cancer, and she had no family history of the disease. But in February, she was suddenly diagnosed with stage 4 lung cancer, meaning it had spread beyond her lungs, in her case to her brain and her spine, like you mentioned just now. So for her, it was totally shocking news to receive for her family as well. Like most people, she thought if you don't smoke, you won't get lung cancer. But the truth is, as long as you have lungs, you may get lung cancer. Am I right?
Absolutely.
So I think a lot of our fears and concerns are exactly like Emily's. I've never smoked a single day in my life. I have no family history. But how come I still get it? And how can I prevent that? There's no way. It's really heng sui, is it?
You cannot 100% prevent this, but we of course can do things to decrease our risk factors. Right. So I think awareness is key, which is what you girls are doing now, right? So I think being aware that this is a possibility, that lung cancer can occur in non-smokers, and lung cancer is not a disease in males. So as a female watching this podcast, you say, oh, okay, so potentially this can happen. So if I have persistent symptoms, then I should definitely get it checked. And other simple things to decrease our risk factors, I mean, most of us are very, very busy, but maybe taking some time out to get some exercise in, having a healthy diet. I think those are certain things that we can potentially do to decrease our risk factors.
So doctor, personally, right, because you're a medical professional and you understand the ins and outs, you know exactly what's going on. For you in your daily lifestyle, what are certain things that you do to, just reduce the risk of anything? And what are things that you would never do because you understand what happens?
Okay, I'm in no way perfect, okay? But I will tell you that I do try to get in exercise at least. Hopefully, if all things goes well, in a good week, I try to get in about exercise 4 times a week, potentially an hour,
healthy.
An hour a day. Yeah, and I try to eat very healthy generally most of the time. And I don't smoke, I don't drink. So that's what I do.
Right.
Yeah.
To bring down the risk for your body.
Yeah. But of course, as I said, I've treated doctors who have been diagnosed with cancer as well. And if I may, because you were just sharing this story about this lady, right?
Yes.
I can share with you very similar stories that are in some ways very heartbreaking and inspiring at the same time,
Tell us.
So I've got this female patient that came to see me. This was many years ago. When she came to see me, she was about 37 years old and she had just delivered a baby, right? And so baby was 2 months old. And I know this very clearly because I had just delivered my baby as well. Okay. So our daughters were same age. So when she came to see me, she brought a newborn with her, with her husband. So she's been having cough for a very long time during her pregnancy. But she'd seen many doctors. Everybody told her this was related to pregnancy, right? And so didn't do very much. And then after she delivered, she still had this persistent cough. And to the extent where she started coughing out blood. So the husband was worried, thought that maybe this is a blood clot in the lung, brought her to the emergency department. Long story short, eventually got diagnosed with stage 4 lung cancer.
Oh no.
And she just had delivered a baby. I mean, this was devastating to everyone in the room, right? But the silver lining to this whole thing was that she had a genetic mutation in her cancer. Okay. It's called ALK or ALK genetic mutation. And the time when she saw me, she had just delivered a baby and her weight was at that time maybe about 37 kg.
Wow, that's very light.
Yeah. Oh. She's 37 kg. So we started her on this medication and she responded really, really well. And till today, she's around. The kid is now about maybe 6 to 7 years old and she's a preschool teacher. The little girl studies in the same preschool as the mummy.
Oh, cute.
Yeah, and she's doing very, very well. Right. So this is stage 4 lung cancer. This is 7 years on, right? She's still on the drug and doing very well. So in a sense, nobody wants to be diagnosed with stage 4 lung cancer, but really things have really advanced greatly and there are many treatment options available. So not just the women. So recently, not too long ago, I saw this young man 26 years old.
Wow.
SAF officer, right? Doesn't drink, doesn't smoke a cigarette, hasn't smoked at all, and he's buff.
Okay.
Right, and runs like 10 kilometers every other day.
Wow.
Right. So he was having a cough, and then again saw many GPs, and then everybody thought this is really nothing, and then he started coughing out blood, and then the doctor said, okay, I think this is probably TB. Send him to the TB unit.
Sorry, what's TB?
Tuberculosis.
Oh,
sorry.
okay.
Right, so that's an infectious disease, and it's endemic in Asian countries generally. So send him to the TB unit, and then but eventually got diagnosed with stage 4 lung cancer. Yeah, and he's 26 years old, and him as well, so non-smoker, and so he had another genetic mutation in his cancer, and that was called a RET mutation, for which we started him on an oral drug, right? And now he's doing really, really well, and he recently proposed to his girlfriend in the Taylor Swift concert.
Oh my gosh! Do we know this person?
We might have seen the videos.
You may have seen this. So
Wait, how many years have passed before this happened? Like before he's happy and well now?
Okay, so he was diagnosed maybe in the early part of maybe last year, so December.
Oh, okay.
Yeah, so his disease is very well controlled, and so he's on this drug. He's back to work and he's back to exercising. So he and his fiancée goes for runs, like 10 click.
I'm so glad to hear.
So again, there is a silver lining.
But going back to your previous story about the pregnant woman who delivered and then discovered she had lung cancer, does this mean that her child might be affected as well?
No. It does not mean that her child is affected. Generally, cancer does not spread this way.
Okay.
Yeah. Cancer is not something that is contagious. So living with a patient with cancer doesn't mean that you would get cancer.
But
or
for the kid, it would mean...
No, it doesn't. It doesn't pass from mom to baby as well.
I see. But family history, yes. So she has to be aware that might happen to her as well.
Potentially, family history is a risk factor.
Okay.
So yes, that's something that she needs to be aware of.
I think we mentioned a lot. Now we learn that, lung cancer is not just exclusive to those who smoke. It does not happen more for those who smoke, for that matter. It could happen
more
to
for
someone.
Males is the same, right?
Correct. It could happen to anyone. It's the, third most
common
cancer for both males and females. And so, just to share, right, the National Cancer Centre Singapore finds that 3 in 10 lung cancer patients have never smoked.
Wow.
So that's quite high. And more than half of these people who have never smoked are usually diagnosed with advanced cancer, stage 3, stage 4.
Because the symptoms don't show in the early stages, right? So the question is then, when should women seek medical advice or support for symptoms of lung cancer?
I think the key word is persistent symptoms.
Right, okay.
Right.
So we go back to persistence.
Yeah. Now that you are aware, right, so we've created awareness, so you know that this can potentially happen. If you have persistent symptoms, definitely go and seek medical attention.
But before I have a persistent symptom, there's basically nothing I can do. Am I right to say that? Or no need to go and have myself checked
At this point of time, yes. But more research is being done to see whether screening for non-smokers, what sort of diagnostic tests that we can do to help to improve early detection. So like in breast cancer, we have mammograms, right? So mammograms can pick up early breast cancer. And when you pick up early breast cancer, they get treated early and the survival is much better. So we need something like that in lung cancer. And that is a big area of research.
Right.
So, something that we see very, very often in common now, aside from smoking, is vaping. And some people think that it's healthier or it's less harmful than smoking. What actually is it?
So e-cigarettes generally, they don't have tobacco. Right, but they have many other chemicals. So these chemicals, it's been known that these chemicals can affect the lungs. They can lead to chronic lung disease and even heart disease. But because e-cigarettes are fairly new, so their association with lung cancer has yet to be established.
Okay.
So if you don't smoke, so definitely please don't pick up smoking. And if you're trying to quit smoking, I don't think going to e-cigarettes is probably the
best way to go about doing things. A friend of a friend told me this. So he has a friend, so I don't know how true this is.
Okay.
But he was recently hospitalized because, in his words, his lungs collapsed. Like, I don't know, he vapes a lot, actually. On a daily basis, he vapes so much that one day his lungs just collapsed and he had to be hospitalized, and the doctors basically did something and saved his life. And he never vaped a single day after that anymore. I think it's because of the chemicals in the vape that causes, I think, a hole in the lungs correct me if I'm wrong, I'm not very, very technical about this, but the air just comes out of the lungs, which is why it collapsed. I don't know how true this is, but after listening to that, I feel like, there's a reason why our government bans e-cigarettes and vapes lah.
I think there was a Straits Times article also. I remember reading it one day, this big article about a young man who was vaping and got into lots of trouble with his lungs, right? So I think if you speak to the respiratory physicians, a lot of them see patients who have complications from vaping, right? So chronic lung diseases, infections or inflammation of the lungs, and some of them, in some cases, can potentially be irreversible damage to the lungs.
Wow.
Right. So I think the key message is please don't start.
Okay.
Yeah.
So now that, Doctor, you've mentioned things are getting so medically advanced, are there still any concerns you have for the future?
If let's say we'll talk about, cancer care in general. So compared to the past, we have many, many more new treatments. So I think if I were to ask you what cancer treatment that you know about, you would probably say chemotherapy.
Yeah.
Yes.
Yeah. But there are many, many new treatments available now. So there's targeted treatment, there is immunotherapies, and some of these treatment has totally changed the landscape of cancer care. So previously, whenever we spoke about stage 4 lung cancer, generally we said, oh no, this is probably like a death sentence, but it's no longer the case anymore. Right. So they can potentially be treated to be like chronic diseases. But there's still a lot more research that needs to be done, because while we have seen many advancements, we still see people developing resistance to these treatments, right? So how to overcome these resistance is a big area of research nowadays.
Right.
Yeah.
So because it's so advanced now, does that mean also that the chances of a relapse is reduced with the technology that we have now?
Yes, potentially. So with the treatment that we have nowadays, so cancer can potentially be better controlled. And if cancer is detected in the early stages, with our systemic treatment options available now, potentially that these cancers may not recur. Right. So compared to the past, yes, definitely. The chances of recurrence will probably be less.
I see. Well, I think it's great we have Doctor on board today to educate us about lung cancer.
He's also a little bit scared.
Yeah, I am, but at the same time, I'm learning so much.
Yeah.
So for people like me who want to understand more, what other educational materials or resources can we refer to?
Okay, so in the Parkway Cancer Centre website itself, you can go and read up about information related to not just lung cancer, many other cancer types and what are the available treatments. So you can find that in the Parkway Cancer Centre website. There are many other websites at the Singapore Cancer Society website that you can refer to as well.
Wow.
Yeah.
Doctor, I feel like this is such a heavy episode, but I'm inspired to do better for my own body at the same time.
Yeah.
Any more words for our viewers or listeners here on the Hush Podcast?
Firstly, to the cancer warriors, to the people who are battling cancer on a daily basis, I want to say that we stand by you and we understand the struggles that you go through, and please take each day at a time. And cancer is no longer a death sentence, it's more like a chronic disease. And I hope that each day that passes will be a better day for you. And to all the ladies who are out here who are listening to the podcast, young or old, most of us are always very busy with many things, looking after other people, but maybe take some time to take care of yourself, get in some exercise, keep up to date with your screening, and if you are unwell of any symptoms, please seek medical attention early.
Well, there's one episode where we spoke to two women who successfully battled breast cancer. And that was also so inspiring. So if you like content like this, don't forget to follow us on Instagram at isclarity.co.
That's right. You can listen to us on MeListen, Apple Podcasts, Spotify, turn on your notifications.
And we are on YouTube as well. So leave a comment if you have any questions for Doctor. I don't know if Doctor is free to go and look through the comments, but in other cases, you can also refer to the website that you just mentioned. All right, with that, thank you so much, Dr. Tanujaa. Thank you.
Thank you,
so
Hazel.
much.
Thank you, Azura. It was a pleasure being here with the two of you.
The pleasure is all ours. All right, we'll see you guys next time. Bye.
So again, all very good questions. Again, all very good questions. So again, great questions.